This is the picture that we're seeing right across England's NHS, and to be fair, in other parts of the country as well. You heard the call today from NHS leaders. Now, the question is, at what level do those numbers have to get to before they will enact Plan B? But today, the Health Secretary, Sajid Javid, said quite firmly that he would not do Plan B, not yet. Although, as I said, he won't tell us what those numbers are. Instead, this is what he said at the Downing Street press conference a couple of hours ago.
We still feel absolutely it's the right decision to start to learn to live with this virus. And a lot of mandatory measures then were put into guidance. And it's asking people to take more responsibility, to follow that guidance.
OK, well, you heard that message from him, but there's another message from the Trust tonight, is that they are very clear to the patients out there. Do not stop coming to the hospital. The hospital is open. If they feel unwell, then they must come and not let themselves get any more sick.
Have you got any pain or anything?
No.
No.
A snapshot. The emergency department this morning.
On some occasions at the moment, we're seeing a busier department than we have done ever before.
Ever before?
I think so, yeah. The last winter pre-COVID in 2019-20 was the worst winter that we'd ever had. And then we had a very brief respite at the beginning of COVID. But it's gradually built back up. And at the moment, we are back to pre-COVID levels and more.
This is Northumbria Specialist Emergency Care Hospital. It's in the title, emergencies. That's what they do, what they're good at.
So I've just got bed 9 who needs to go to the discharge lounge.
Okay.
Who just need handed over to the
And have you
discharge
contacted them yet, or do you need me to do that?
No, it's all right.
Okay, you're all done.
June Burke has been here since 2:30 this morning with an unidentified pain in her back.
And they were a bit worried in case it was a blood clot. So that they've been investigating me to that effect, you know.
How are you feeling now?
I feel a bit better now, actually. I do feel a bit better.
What they have today is an exit block. The patients have been seen, but those who need to be transferred to wards are for the moment stuck. As we've moved through this hospital, there is one overriding theme. They are under pressure, and this isn't even winter.
Should we check his blood sugar? It was 11.
Ward 9 was opened up a couple of months ago.
So tell me again why this was opened.
So this was essentially an empty ward that we sometimes used if it was very busy, that we would kind of use the extra borders ward, but we'd have to cobble together the nursing staff, the medical staff and others to manage it.
Actually, beds, number of beds is actually number of staff.
So beds we've got lots of them in cupboards. Wards, we've actually got a fair number of wards we could potentially utilise, but it is nursing staff and others to do that day-to-day looking after the patients that's the biggest issue.
They've just recruited more staff across the trust, but sickness or the need to self-isolate means there are often gaps. This deputy ward manager was meant to be on a day off.
Has it been busy today?
It has been busy, yes. Lots of discharges, lots of admissions.
Is it always like that?
Yes. On the acute medicine side of it, it's the fast-paced turnaround. So we want them in, admitted and discharged to either home or to a different area as soon as possible.
As of this morning, this hospital was nearly 99% full. That is, in NHS speak, running hot. So teams work across the wards to identify patients ready to go home. But no hospital is an island, and lack of care staff in the community can mean it's harder to discharge.
So I think this lady was referred in via physio yesterday, had some initial assessments via your colleague Amy. Yeah. She came in on Friday following a fall.
They're assessing Mary Swindles, who was left badly bruised and shaken. They will go with her to make sure her home is safe.
We'll get you into your house, make sure you're settled, and then just see how you get on around the house with your new walking aid. So maybe see you make a hot drink for yourself and things like that.
I'm very happy with where I am, and then there's a lot of support around.
Yeah.
Good.
You seem very independent.
Northumbria Trust is across a number of sites, and by splitting emergency care from elective surgery, it's helped them keep their waiting lists down and keep the COVID patients separate too.
It is clearly hard for the staff. Yes, this hospital is highly rated. Yes, their waiting lists are lower than most. But the pressures are growing, and this is what they tell me. They are worried that they can't always provide the care that they want to for their patients. And they're tired.
Can you tell us your numbers, Claire?
COVID positive, I've got 9 patients. I've got 2 COVID level 2s, 3 level 2 non-COVID. Current vacant beds is my 1 RSU escalation bed.
A huddle to assess the situation on critical care in the theatres and the respiratory wards. They are busy, not least because there is still COVID. There may be fewer patients right now, but on critical care they are just as sick as they ever were. And today, of the 6 patients, 5 had not been vaccinated.
We've been treating patients for 18 months, and anything we can do to get the message that COVID has not gone, and our staff have worked in full PPE for 18 months that are all tired, and we need to know that we've done as much as we can to prevent our vulnerable patients, but also folk that perhaps through complacency or uncertainty haven't had a vaccine so far. And we'd really encourage folks to, speak to their healthcare professionals, speak to the vaccination teams, and think about booking a vaccine, because that's going to help us get through.
On the respiratory ward too, they're seeing more vulnerable patients who had been double jabbed but are catching COVID, their immunity waning. So another message. Get the booster, they say.
And I'm joined now by Elliot Sykes, who is both a consultant and a director of the Northumbria Healthcare NHS Foundation Trust. I should say we're here at a training facility, which is not live, which is why we're unable to speak without masks.
That's right.
Thanks very much for joining us this evening. The NHS Confederation is warning of stumbling into a crisis. Is that a concern you share?
I think it's certainly challenging in terms of the winter that lies ahead of us. We're very busy already. It's something that we have to actively monitor and manage on a daily basis in terms of ensuring that patient care remains safe and of a high quality, and also in terms of looking after our staff. I guess it's not just about the emergency stream as well, it's about maintaining the elective stream, which we've had a lot of success with, and it's that tension between the two in terms of trying to manage the balance.
And as Victoria said in her piece, you have some parts of the hospital already running at around 99% capacity, running hot as the jargon goes. If that is the case, how do you continue with that elective surgery that is so important at the same time as reaching capacity?
Yeah, so we have an advantage. We're a multi-site organisation, so that's allowed an element of segregation, if you like. But it is about actively managing those pressure points on a daily basis because they move around. And we've got very good at that. We have daily meetings, but I mean, ultimately, worst case scenario, we have additional tiers, if you like, in our plan so we can release extra capacity. That's where the tension lies for us, because there's a consequence, and that's potentially on the elective programme. So it's a constant balancing act.
And you talk about that tension. It can only increase when you look at the COVID figures, surely?
Well, that's the risk. Who knows what winter will bring in terms of whether it's COVID, flu. We're not clear on what will happen with the elective programme in terms of who's still to come forward. But inevitably, that winter pressure could have a significant impact on the elective programme and the backlog.
And I just wonder, this comes at the end of 18 incredibly tough months for all of your staff.
Yes.
How are things in terms of morale and keeping staff fit and healthy themselves?
Yeah, so we're very aware of this. They're tired. People are nervous. They want certainty. We try and give them clarity in terms of our plan. We look after our staff. We understand where our hotspots if we have teams under pressure, and we really try and look after them. Our sickness rates are up, and that creates a pressure with our workforce in terms of looking after them, and also how we just run the hospitals on a day-to-day basis.
You may have heard the Health Secretary today saying he doesn't want to move to Plan B, which is what the NHS Confederation want. He is talking about everybody taking little steps, masks in crowded areas, just being a little bit more aware.
Yeah.
Is that enough to stave off real trouble for yourselves and the rest of the NHS this winter?
So I can't really comment on what that will do or achieve at a population level, but I think all we can say is within Northumbria, we know that getting people to wear masks, socially distance, screening them on a weekly basis has been incredibly effective in terms of minimising hospital-acquired infections and also helping people and patients feel safe.
So looking ahead, you say you don't know what the winter will bring, but this winter promises perhaps more threats than others.
Yeah.
How confident are you that you'll be able to manage?
So I think we'll manage. We've managed at every phase through the COVID pandemic. We have to create that clarity in terms of the plan, and we have to remain agile because we have a plan now that will need to have to change all the way throughout winter. We've got a really strong track record with that, as does the wider NHS. So I'm confident, but it will be extremely challenging.
Elliot Sykes, thanks very much for talking to us this evening.